Let's talk about sex, baby. Let's talk about sex therapy. All right, and the difference between sex therapy and sex surrogacy. This is where it gets kind of confusing for people, and so let's kind of dispel any myths about what this is. Sex surrogacy is literally where you may actually have physical touch and interaction with a therapist. That's called a sex surrogate. It is a different type of experience, and that is not something that I do. I am not a sex surrogate. There will never be any type of physical touch between myself and my client. A sex therapist, I want you to think about, is a guide to your sexuality and your sensuality. So in sex therapy sessions, we'll be talking about things like your sexual blueprint. Just like we have a joy blueprint, we also have a sexual blueprint. And your sexual blueprint is all the stuff that turns you on and all the stuff that turns you off. And you are born with that. Okay, now you can choose to either promote the stuff that you're turned on by, or you can try to turn it off. But for the most part, what you like is what you like, and you don't really have a lot of say in that. Sex therapy does not include the sex therapist telling you how to have sex, the logistics and the mechanics of sex. That is not included in sex therapy. We will be teaching you how to communicate about the stuff that feels good to you, your desires, your wants, your needs. And not only to communicate those things to a potential partner or multiple partners, but to describe that to yourself. Because if you yourself, you don't know what feels good to you, you're not going to be able to describe it to somebody else. Sex therapy is also about defining what is intimacy to you. In a previous video, I talked about how intimacy is into me see, which means getting to know yourself in a way that says, this is all the stuff that feels good, this is all the stuff that feels bad, this is what I consent to, this is what I don't consent to, here's my triggers, here's my glimmers, and being able to communicate about all of those different types of things. And also, in sex therapy, you may also be able to use that as a resource for things like sex toys or different types of lubes or different types of medications that you may need. Now, it's also important to rule out different physical barriers that may be causing you pain, something that may be getting in the way, a disorder, for example. And then if you are diagnosed with those things, it's giving you ways to be able to work around anything that may be inhibiting you from having a healthy sex life. And lastly, it's very important to get clear on your individual needs and wants so that you can communicate that to the people that you want to be intimate with. A previous video, I talked about philautia, which is self-love. And so even though I was saying it's not that type of self-love, it is also about getting to know your body. So in sex therapy, you don't have to have a partner to be able to come in. You can come in yourself and say, I want to repair my relationship to sex. It's very important for us to repair our relationship to sex because we live in a society in America where, for the most part, sex is pretty taboo. Now, it's weird because it's all over the place. And it's like, look at me, look at me, look at me, here's sex, but let's not talk about it in a way that's actually educational or that supports the stuff that you want. It's just like this weird in-our-face thing all the time. So why is it taboo? Well, it goes way back into our culture. It's kind of a Puritan type of understanding of our bodies. And we are doing everything we can, even in 2023, to sort of undo that, like, your body is gross and don't talk about it type of thing. And we're getting there over time. And to talk about something taboo, again, we have to destigmatize it, just like we do with addiction and all the other stuff that feels like we want to put it into a dark corner. But if we can talk about it as a very natural thing that we need to do, and that if we don't, we are actually not taking good care of ourselves, that's a wonderful way to talk about it. It's just like, you know what? I need to go to the gym, I need to move my body, I need to eat healthy foods, and I need to have some type of sex because physical touch is important. Whether you're touching yourself or somebody else, it's really good for your nervous system. I promise. So sex therapy is a lot of different things. Ultimately, you're talking about the stuff that turns you on, turns you off, and the best ways to communicate about it. I get a lot of couples that come to me and say, gosh, it feels like we just moved from lovers to roommates, and that's not the end of the world, but let's talk about what's the difference between the two, right? So when we think about roommates, we think about people that are just kind of sharing mutual space, right? You're in the kitchen together and you're like, hey, can you pass me the eggs? Do we need to get laundry detergent? Do we hire the housekeeper to come this week? Or are you going to clean the toilet or am I? It's like not very sexy and super not cute. And sometimes it really takes all of the romance out of the relationship. And that's what it feels like to just be roommates. Where in contrast, lovers lovers, they share space, they share intimacy, they share dreams and passions. They have deeper moments of connection where they're actually having experiences together as opposed to parallel experiences where we're living lives on two tracks as opposed to intersecting. So, if you feel like you've gone from lover to roommate, there's a couple of things that you can do, and there's certain things you can address to see if you can find that spark again. And then also, it's really important to, yes, schedule intimacy. Now, I know I get a lot of pushback on this one because it's like, hey, shouldn't intimacy be fun and spontaneous and super sexy? Yeah, ideally, that would be fantastic. But if you're very busy, spontaneity is not always an option for you. We schedule things because they're important. So scheduling intimacy doesn't necessarily mean that you have to schedule sex. Intimacy is a lot of different things. Intimacy is actually in, to, me, see. I want you to see me. So sometimes intimacy is sitting down and saying, hey, can we schedule 15 minutes where we literally just look at each other? Can we schedule 15 minutes where we just hold hands? Can we just share a bowl of ice cream with each other? Can we reminisce about something from the past that brings us a lot of joy? All of that is intimacy. And if you actually have to schedule intimacy where you're having sex, do it at a time where both of you feel super comfortable, where you don't have any distractions, and maybe even if you have the luxury to, maybe go outside of the house, get a hotel room, something like that, it is totally okay to have to schedule it. All of these things are little things that you can do to help try to bring that spark back. Now, just because you went to lovers and roommates, it doesn't mean that it's the end of your relationship. This could totally just be a phase, and it's very important, though, for you to acknowledge it along the way so that you don't totally get lost in that space where you just literally look at your partner and say, did we pay rent this month? That is no fun. So please take the time to communicate with your partner to schedule all those things where you can reconnect, find each other's love languages again, and you will find your way back to being lovers. Hi, my name is Alexis Marin. I'm a registered drama therapist, a life coach, and a speaker. Let's talk about boundaries and consequences, and also another little added tidbit, something called guardrails. A boundary is when you are asking somebody else to change a behavior that they are doing. For example, let's say that you are in an argument with your person and they call you stupid whenever you argue. You're going to say to that person, hey, my person, next time we argue, please don't call me stupid. That is you setting a boundary. You are asking for a behavior to change. Now, guess what? Behaviors only change if somebody knows that there is a consequence attached to if they do that behavior again. So a boundary is only a boundary as long as there's a consequence attached. Now here's where people go wrong with the consequences. Go back to that same couple. They are calling each other stupid in their arguments. Now, unless you are actually ready to get divorced from that person, don't say, hey, next time you call me stupid in an argument, I'm going to divorce you. Unless you're actually willing to divorce said person, because otherwise it's just a blind threat. And then the divorce word comes in, and then when you really mean it, they don't think you really mean it. So consequence has to be something that you are willing and able to follow through on. So for example, next time you call me stupid in an argument, I am going to ask you to sleep on the couch. If that is something you can really follow through on, you must do it to show that you mean business. Otherwise, that person's going to keep going back to that behavior over and over and over again. So boundary, consequence, and consequence has to be something you are willing and able to follow through on. Now, a guardrail. A guardrail is a boundary that you set for yourself. Think about it. A guardrail, when you're going around the curves on a hill, a guardrail is that thing that keeps you on the road and keeps you from going over the edge, right? So a guardrail is what you set for yourself to stop yourself from doing poor behaviors. For example, let's say you're going out on a Friday night. You're going to say, okay, I'm going out tonight, but my guardrail is that I'm only going to have 2 drinks and I'm going to come home by 11 p.m. That is my guardrail, okay? And instead of setting a consequence, you're going to give yourself a reward. If I come home by 11 p.m. and I only had 2 drinks, the reward is, A, I'm going to feel pretty good. I'm in a good night's sleep. And then maybe tomorrow morning I get to wake up and I get to go do the thing that I really want to do. So guardrails have rewards. Boundaries have consequences. Guardrail you set for yourself. Boundary you set for somebody else. That is my sound advice with Alexis Marin. For any more free resources, things that are interesting for you, if there is a topic that you want to have more information about, please visit my website, which is www.alexismarin.com.